So, today I want to talk about insulin and the inefficiencies of capitalism. I want to start off by highlighting the work of Open Insulin and their efforts to create cheap and affordable insulin for people. I hope to talk about this organization very briefly and then use this opportunity to explain why their efforts are so important by analyzing some of the history and context of insulin and why its costs are so high, and put all of this in the larger context of the inefficiencies of capitalism. So let's start by taking a look at Open Insulin's mission. If we go to their website, they declare that healthcare is a human right. In order to give people who depend on insulin ownership over their lives, we will democratize the production of insulin. Communities will own the manufacturing systems, and insulin will be produced and distributed on a local level. We plan to keep the means of production accessible to all by making our work open source. And if we explore their What We Do tab, we find things like our goal is to develop easy to manage, easy to repair, and affordable equipment to sustain local and community built insulin production. Open hardware equipment could be used for research and pedagogic purposes in addition to small scale manufacturing. And we are looking forward to contributing it to the biohacking community in general. And if we look at some more information that's publicly put out about them by freethink.com, biohackers to share how to make insulin with the public. A group of dedicated biohackers believes that making insulin more accessible requires taking the monopoly away from the big three pharmaceutical companies that produce it. So they've started the Open Insulin Foundation, a nonprofit with the plans to develop the world's first open source insulin production model. With open source hardware equivalent to proprietary bioreactors, the foundation hopes to give labs across the world access to the equipment needed to produce the insulin protein on a small scale. But the process hasn't been easy. For 6 years, DeFranco's team has attempted to reverse engineer the production of insulin with volunteer-led experiments at their community labs in cities like Oakland, Baltimore, and Sunnyvale, California. Today, they're beginning to see hopeful signs of a major breakthrough, like getting an FDA-approved protocol for making injectables. The team estimates the cost will be 98% cheaper than Big Pharma, reaching prices as low as $5 to $15 per vial. The best part? They're willing to give away their plans for how to make insulin for free. So that's something that I really just want to highlight and emphasize how great their endeavor is in that regard. The idea of making insulin cheap and affordable for people, and for labs to be able to produce this pretty much at cost and have this be open source, is something that I think will drive a lot of costs down and make insulin much more accessible to a lot more people globally. Not only is this organization attempting to lower the cost and making it all open source and putting it in the hands of communities, they have put a lot of hard work and dedication into this project. Which begs the question to me, how did we get to this place where an organization has had to spend 6 years reverse engineering a medication that already functionally exists? What is the purpose behind all of that? Well, there are 3 companies, as we saw, who control about 90% of the world's insulin supply. Novo Nordisk, Sanofi, and Eli Lilly literally have the ability to determine whether or not some people who require insulin live or die. You could call this a hyperbolic statement if you desired, but in our world, if you can't get access to insurance and you can't afford to pay, or you happen to be from a region of the world where insulin isn't always as accessible, these companies, with their effective monopoly, essentially do control life and death. The story of insulin under capitalism is actually a really tragic one that ends up leading to the point where these 3 companies have control and of monopoly. In fact, the origins of insulin happen when inventor Frederick Banting discovers insulin in 1923. He actually refused to put his name on the patent. He felt it was unethical for a doctor to profit from a discovery that would save lives. Banting's co-inventors James Collip and Charles Best sold the insulin patent to the University of Toronto for a mere $1. They wanted everyone who needed their medication to be able to afford it. I would like to put it out there that the University of Toronto, who acquired it for $1 from each of the 3 inventors, was a purely medical research facility at the time. And so they wanted this to be able to be researched and reproduced so people would have access to it. Today, Banting and his colleagues would be spitting in their graves. Their drug, many of which 30 million Americans with diabetes rely on, has become the poster child for pharmaceutical price gouging. So, when we look at all of that, we really have two questions now that come from this starting point of the history. How is it that if this medication was invented in 1923, almost 100 years ago, 98 years in fact, how is this still under any sort of patent, or how is that still active in any way that's preventing other people from producing generics or any sort of alternative? And the second question that comes to my mind is, how has competition not driven down the price of insulin instead of making it go up? Well, it turns out there's reasons for both of these things. As for the generic insulin, drug companies have made incremental improvements on the original formula over the past 90 years, which have kept drug companies in control of patents and made generics impossible. A generic version of insulin, the life-saving diabetes drug used by 6 million people in the United States, has never been available in this country because drug companies have made incremental improvements that kept insulin under patent from 1923 to 2014. As a result, say two Johns Hopkins internist researchers who may need insulin to control diabetes can't afford, and some end up hospitalized with life-threatening complications such as kidney failure and diabetic coma. Now, this article was produced in 2015, which is why we see the date of 2014, but I assure you this is still active to the present. In a study published in March 19th of 2015 in the New England Journal of Medicine, the authors describe the history of insulin as an example of, quote, evergreening, in which pharmaceutical companies make a series of improvements to important medications that extend their patents for many decades. And it keeps generic versions off the market because they're considered obsolete. And newer versions do have somewhat more benefits, but not enough to justify there being no sort of generic involved. Further, it can actually become very painful and cause a lot of suffering for those who cannot afford things, and the complications can be dire. Now, as for the second question, that gets a little bit more complicated and a little bit more into the area of in the area of law. So, the price of insulin has actually skyrocketed over the past, I want to say 20 or so years, where the three manufacturers that I've named before raised their prices of their products in near lockstep with each other, prompting outcry from patient groups and doctors who have pointed out that the rising prices appear to have little to do with increased production costs. So what's essentially going on is that as each company raises its price, the other companies are also raising their price. In fact, Bloomberg notes that in 13 instances since 2009, the prices of two of the major medications, which dominate the market and make about $11 billion in combined sales, have gone up in tandem in the US. And when we look at the shadow pricing that's shown here, we see that when one medication goes up, the other one rises not long after. Sometimes they rise in the same month. So there was an assumption that there was some form of alleged price fixing going on or some sort of collusion going on between these companies. And since they are the three companies that do have so much control of the industry, they are functionally an oligopoly rather, and as such, if they price fix, they function as a monopoly. And so there's antitrust laws that are supposed to make sure that doesn't happen. However, because of this alleged thing, a lot of these companies have fought back. And none of these court cases have really come to anything in the recent years. However, I do want to note that the lawsuit filed in federal court in Massachusetts accused the companies of exploiting the country's opaque drug pricing system in a way that benefits themselves and the intermediaries known as pharmacy benefit managers. It cites several examples of patients with diabetes who, unable to afford their insulin treatments, which can cost up to $900 a month, have resorted to injecting themselves with expired insulin or starving themselves to control their blood sugar. Some patients, the lawsuit said, intentionally allowed themselves to slip into diabetic ketoacidosis, a blood syndrome that can be fatal, to get insulin from hospital emergency rooms. That is absurd and that is sick. There is a huge problem when there is a widely available medication that should only be costing in the range of maybe $20 a vial, where we're being charged as a society $300 to $350 plus a vial, where it's costing people $900 and upwards a month. Some people have reported as high as $1,200. And the person who set up Open Insulin, I remember reading about them recently, and I think their costs had gotten to approximately $2,400 a month, which is why they set out to set up Open Insulin in the first place. These prices are absurd, and when people are having to choose between using expired insulin, tapering down their dosages, or when they're trying to slip into diabetic ketoacidosis just to be able to get some insulin from the emergency room, there is something really wrong with that system and that structure. So when we have this, and then we find that the courts can't seem to find that they're price fixing or allegedly price fixing and that it's not coming out as true, we need to really evaluate if this system is working to identify a lot of the problems that are going on. Now, another response that's happened is that some states and the federal government have responded in certain ways to attempt to fix the price in certain areas, which brings us to an example of that in Tennessee, where Tennessee State Representative Jason Hodges wanted to do something about the soaring costs of insulin. He learned that in the United States, the price of insulin had tripled from 2002 to 2013 and doubled again from 2012 to 2016. For some diabetics, spending as much as $1,200 a month. So he wrote a bill to forbid any pharmacy from charging more than $100 for a 30-day supply of insulin, which, while still quite a lot of money for some people, especially in our current economic situations, would be far more affordable than the $1,200 a month that they are being charged. Now, when this person put out the bill, he was approached by a lobbyist from Eli Lilly and Company, one of three of the multinational drug companies, and the lobbyist handed him an amendment, and Hodges told the fair warning and said that the co-sponsors had already signed off on the changes. Eli Lilly's proposal would allow for the capped monthly cost of insulin to be $100, but only for diabetics with health insurance. It offered nothing to the uninsured. Knowing that many of the people struggling to afford insulin in Tennessee are uninsured, Hodges rejected the changes. He says lobbyist S.D. Harris warned that Eli Lilly would fight the bill unless he reconsidered. And this brings up one of the biggest problems here. Whenever a company is challenged, whenever we have these situations where we try to move policy in the direction of working for the people, especially when they're not insured, especially when insurance may not be available for certain people for certain reasons, these companies will come in and they will lobby for different ideas, and they will try to change the law and make sure that people don't get what they need. And that is just another cost of business for them. All of these things, in fact, have been a cost of business, including the loss of life that is involved. And all of this really brings us back to the present day, where we have an organization, Open Insulin, who has spent 6 years of research and effort, 6 years that could have been spent in numerous other fields of medicine, numerous other ways of researching things, numerous other ways to develop different aspects of science and anything else, right? This was 6 years worth of a ton of work that was done in order to reproduce a drug that already exists, in order to bring forward the vision of a doctor who invented insulin in the first place and wanted to keep it available for the public and open source for everyone over 100 years ago. Insulin was supposed to belong to the public, and it now belongs in the hands of 3 corporations. The number of lives that have been lost, the amount of suffering that has been inflicted by driving up these drug costs, belongs to the tally of damage inflicted by the inefficiencies of capitalism in this system. The drug companies have used their resources to drastically raise their prices, and with no increased production cost, that amounts to almost pure profit. Now, alleged price fixing, lobbying for laws, and exploiting patent loopholes and making demands of politicians to prevent changes from happening, these are just the costs of doing businesses for large companies like this. This is how they maintain their monopolies on sectors, and this is how they remain control in a drug that literally has the power of life and death in their hands. As long as people are in a position where they don't have a choice because they require medicine to live, they will pay whatever they can. And that is how the system works. Now, if you like this video, please give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my Discord in the description down below. My name is Anarchist Tara, and I thank you for watching.